And you're up. Go ahead.
Good night, everyone. Good evening in some parts of the world, but in the Caribbean, in this part of the Caribbean, I'm saying good evening to everyone. And I want to thank everyone for coming on and supporting us on a weekly basis. So the topic tonight is quite timely. It is a very important topic that affects a lot of women, even women who are not going through menopause. So thank you all for being here today. My name is Nurse Maria, and I am a registered nurse. I'm a midwife, and I also specialize in sexual health, women's health, health education, and a big part of that is dealing with menopausal issues during menopause and menopause itself. So hence the reason why this channel is important. We are dealing with a lot of topics here that affect a lot of women at this stage in our transition or in our development. Now, over the years, I have worked with many women who are navigating changes in their menstrual health, particularly during perimenopause and beyond. So today, we are discussing a very timely topic, which is a topic that affects many women over the age of 45, but is often misunderstood. It is heavy menstrual bleeding. Now, while changes in the menstrual cycle are common during this stage of our lives, excessive or prolonged bleeding is not something to ignore. It can be a sign of hormonal imbalances, underlying health issues, and even more serious medical concerns that require attention. So, heavy bleeding can significantly impact a woman's physical health, her mental well being, and her daily life. It can lead to fatigue, anemia, anxiety, and social discomfort, making it quite difficult to keep up with work and family, as well as personal activities. Yet, many women believe they just have to put up with it. Assume it's a normal part of the aging process. So, the good news, there is good news. The good news is that there are solutions available. Understanding the causes, recognizing warning signs, and speaking and seeking the right medical care can make a huge difference in improving the quality of our life. So today, my goal is to help you to feel informed and to be informed and empowered, which is important for you to take charge of your health. So today we'll be discussing, and the topic would be menorrhagia, or what we generally call heavy menstrual bleeding. What is considered heavy bleeding? Heavy bleeding, well, this is what qualifies an excessive bleeding and how to recognize when it is abnormal. We are dealing with that. We are dealing with the common causes and the health risks, from perimenopause related changes to conditions like fibroids, endometrial hyperplasia, and even cancer. We'll explore the potential reasons behind heavy bleeding, when to seek medical help, and what treatment options are there available for these conditions. We'll discuss when to see a doctor, diagnostic tests, and treatment approaches, ranging from lifestyle changes and medications to medical procedures if necessary. By the end of this presentation, I am hoping that you all have a clearer understanding of what's normal and what's not, and what steps you can take to manage heavy bleeding effectively. So what I would like to do at this time is to ask you ladies to have a little piece of a pen and a paper, because you're going through a lot of things right now. And I want you all to write what are the things that, know the important points that may be affecting you, or probably a family member or a friend who may be having these issues at this time. So a pen and a piece of paper, write, so that you can have these important points. I will repeat some of them so that it would stick. Okay, so let's deal with understanding heavy menstrual bleeding. Now, what is the definition of heavy menstrual bleeding? Heavy menstrual bleeding, in abbreviation, it is known as HMB, also known as menorrhagia as well, is more than just a heavy period. It is a condition that disrupts daily life, affects our overall health, and can even indicate underlying medical issues. But how can we define what is truly heavy bleeding? Here are the key signs. Excessive blood loss. Excessive blood loss, which is losing more than 80 milliliters of blood per cycle, is considered heavy. Now, since it is difficult to measure blood loss, a practical way to recognize this is, one, if you are soaking through a pad or a tampon every 1 to 2 hours for several consecutive hours. And I'll repeat that. If you are soaking through a pad or a tampon every 1 to 2 hours for several consecutive hours, when we say consecutive, continuous or straight hours, continuously, right? Every 1 to 2 hours, you're changing a pad. That is basically what it means. Or you're changing the tampon, right? If you are needing to double up on protection, which is using both a pad or a tampon, and for those of us who don't use tampon, if you're doubling up on your pads, or sometimes tripling up on the pads, or some women, the bleeding is so heavy, they may be using double or triple pads as well as adult briefs. It is that heavy with some women. So that is what we call excessive. Another thing we want to look at, pointer, is what we want to look at now is prolonged menstrual flow. How long should you start to be concerned when you are bleeding excessively, continuously? What are the points you should look at to note, well, this is serious? Now, prolonged menstrual flow. A normal period lasts between 4 to 7 days. Some women have a 3-day cycle sometimes as well. But generally, in average, you would find there is a 4 to a 7-day cycle, which is quite normal. Bleeding that lasts longer than 7 days is considered excessive. Let's look at passing large blood clots. If you're regularly passing clots larger than a quarter, which is about 1 inch in diameter, this may indicate abnormal bleeding. So you're passing clots, and a number of them that are bigger or larger, about more than a centimeter, or a diameter. This may indicate abnormal bleeding. This is also accompanied by, many times, severe cramping and discomfort. While some cramping is normal, a little cramping is normal, but that debilitating pain that interferes with daily activities is a red flag. Now, if you find yourself using excessive pain medication to manage period pain, then that's another sign that something is not right. It's important to remember, though, that even if you've had heavy periods for years, that doesn't mean that that is normal. Many women assume they just have to tolerate it. But persistent heavy bleeding can lead to many serious health consequences. So let's look at common symptoms and red flags. Heavy bleeding isn't just about inconvenience. It can cause significant physical and emotional strain. Here are some common symptoms and warning signs. Let's look at physical symptoms here. Fatigue and weakness. Excessive blood loss can reduce oxygen levels in the body, leaving you constantly drained. Now, this kind of fatigue and weakness is not like you did a hard day at work and you come home burnt out and you take a sleep and you get up and you feel refreshed. This type of fatigue we're talking about is you come home, drag through work with the heavy bleeding, it, you take a rest and you get up and you're still feeling drained to the point that you're dragging, you're always tired, you're always feeling weak. That is not normal when these symptoms are like that during having these heavy symptoms. What about dizziness and or lightheadedness? And in some cases, there may be fainting spells. So a sign that blood loss is affecting circulation, that that means that is what it's going on at this time. It's affecting circulation and your oxygen supply. This is another red flag. So many times you're feeling dizziness, it's just coming on like that, and you're feeling lightheaded. And in some cases, as I said, some of us we start to have fainting spells. Anemia is another physical symptom, which is low iron levels. Symptoms of low iron levels or anemia are your skin is looking pale, weakness, constantly having headaches, especially during and after a heavy period. And another sign that a lot of women may not um, be aware of, low iron can cause brittle nails. So you find you're having these symptoms. What about shortness of breath? That is another physical symptom. Even minor physical activities, just like getting out of your bed, trying to get up to make breakfast for yourself or even your family, and you are just exhausted. Exhaustion. If your body isn't getting enough oxygen, it may cause you to have this shortness of breath. You're breathing heavily, you're breathing quickly, even for minor physical activities. What is the impact of this heavy bleeding on your daily life and your emotional well-being? Disruptions to work and social life. If you need to plan your schedule around your period, if you avoid social events or miss work due to heavy bleeding, it is a problem. Emotional distress, anxiety, frustration, or even depression can arise from feeling like you have no control over your body. Sleep disturbances, waking up multiple times at night to change pads or tampons or both can lead to poor sleep and exacerbate the symptoms. So increase fatigue now, along with what you're experiencing with the bleeding. If you're experiencing any of these symptoms, it is therefore important to take these symptoms seriously. Heavy bleeding is not something that you have to live with. It has real consequences for your health and well-being. Now that we've defined what heavy bleeding looks like, and its symptoms, let's take a closer look at the most common symptoms and in women 24 to 35 years of age. Heavy bleeding in younger women, age group 24 to 35. Heavy menstrual bleeding, HMB, in women age 24 to 35 is often linked to hormonal imbalances, structural issues in the uterus, underlying medical conditions, or pregnancy-related factors. Now, while occasional heavy bleeding may not be concerning, frequent or prolonged heavy bleeding can signal an underlying problem that that you need to pay closer attention to. So let's explore some of the most common causes here. Hormonal imbalances. Hormonal fluctuations can play a major role in regulating the menstrual cycle. When hormones are out of balance, the uterine lining may thicken excessively, a whole lot, leading to heavier and longer period. Estrogen, progesterone imbalances. Estrogen, which are one of the two hormones, female sex hormones, that are important during this time. Estrogen, one of the main jobs of estrogen, which is to helps to build up the uterine lining. While the progesterone helps to regulate the shedding, which is how heavy the flow should be. Now, if estrogen levels are too high or progesterone levels are too low, the lining may become too thick, resulting in heavy or prolonged period. Common triggers of this imbalance may include stress, rapid weight loss or weight changes, poor diet, and underlying health conditions. Okay, let's look at polycystic ovaries, which is a common problem with younger women between the ages of 24 to 35. Polycystic ovaries, which we know commonly as PCOS, and also we are looking at irregular ovulation. PCOS is a hormonal disorder where ovulation is irregular or absent. Now, without regular ovulation, that is when we produce the egg and it comes out that is when we ovulate. Now, without regular ovulation, progesterone levels drop, leading to long gaps between periods followed by extreme heavy bleeding with menstruation when menstruation finally occurs. Now, when we go, many women who have polycystic ovaries, what happens? Sometimes for months, they do not see a period. But when that period finally comes, it comes extremely heavy. When it finally comes, causing a lot of problem, a lot of bleeding, cramping, discomfort. Women with polycystic ovary often experience irregular cycles. They have problems with acne. They have excessive hair growth, and also it may cause a lot of weight gain. Now, the takeaway here is if your periods are consistently heavy and unpredictable, hormonal testing may help to identify your imbalances. So you go to the gynecologist and they relate to them, they take a history and what is actually going on with you. And okay, let's check your hormones to see what's going on. And they would know the balance between the progesterone and the estrogen levels. So they would do ultrasounds as well, as we'll get to that stuff to see what is going on with that area there, your ovaries as well. So let's look at uterine related conditions now. Structural abnormalities in the uterus can cause excessive bleeding, cramping, and discomfort during menstruation. Let's look at fibroids and polyps. You know that fibroids are, many of us who are not aware of fibroids, they are, many times when you hear the word fibroids, a lot of women get afraid, right? But it is not, they are non-cancerous growths in the uterus that can cause heavy bleeding. They can cause prolonged bleeding, painful cramps, and many times they cause pressure on the surrounding organs. So many times you go to use the bathroom to pass your urine, and you're having problems because of the position of the the fibroid, where it's positioned in the uterus, causing pressure on that structure there. So you're getting problem there because it's pressing on that organ there where you want to pee, you cannot pee. So the urethra there is pressure there, and you're having problems to pass your urine, pressure on that area. And in many women too, according to the size of it, they actually feel the lump in when they press that area there by the wound area above the underneath the tummy there. So that is another sign that you need to go get that checked out. And it is very common in women of color. Fibroids is a big issue. So it is something you need to check out if you are having these issues. Let's look at polyps and small growths in the uterine lining. These can lead to spotting between periods and also heavy menstrual flow. So polyps are small growths, and sometimes as a sexual health nurse, you would see the polyps sometimes, many times on, when I'm doing pap smears, I would see them on sometime in the, what we call the cervical os, which is the opening of the womb, some of them coming from that area. They're coming from inside out. So you're seeing them coming right there and blocking that entrance. Some of them, you see them on the outer surface as well of the os. So, and in many cases, many women, it causes excessive bleeding. Let's look at endometriosis and adenomyosis. So there is a difference between two. Many of us know endometriosis, which occurs when the uterine tissue grows outside of the uterus. It leads to severe pain, heavy bleeding, and in many cases, infertility issues. Adenomyosis happens when the uterine lining grows into the muscle aspect of the uterus, because the uterus is a muscular structure as well. So sometimes the uterine lining grows into the muscular part of the uterus, resulting in intense cramping, bloating, and prolonged bleeding. So the takeaway here is if you experience chronic pelvic pain along with heavy periods, conditions like fibroids, polyps, or endometriosis could be the culprit or the cause. In cases like these, ultrasounds or MRI scans can be needed to diagnose these issues. Other medical conditions I want us to look at. Sometimes heavy bleeding is a symptom broader than health issues, rather than just a menstrual problem. So let's look at some of them. Thyroid disorders. The thyroid gland regulates metabolism, and it also regulates estrogen and progesterone, which are the reproductive hormones. So, as well as hypothyroidism. So we have the thyroid gland, which regulates metabolism and the reproductive hormones. There can be a disorder going on there. Hence, the reason you're having these problems now with bleeding. We are looking now at hypothyroidism, which is an underactive thyroid. This can lead to long, heavy periods, fatigue, weight gain, and depression. What about hyperthyroidism, which is an overactive thyroid? This can cause lighter or even missed periods, anxiety, and rapid weight gain. Blood clotting disorders. Some women have undiagnosed bleeding disorders. There's a disorder called the von Willebrand disease, which makes it harder for blood to clot, which leads to prolonged excessive menstrual bleeding. Women with these conditions can and they may bruise easily or experience frequent nosebleeds. Also, we have to look at another cause of this bleeding at this age group, if the effects of certain medications. Let's look at birth control pills. Some hormonal contraceptives can cause what we call breakthrough bleeding. Breakthrough bleeding is bleeding that occurs between periods. Your period is finished and a bleeding starts again. We call that breakthrough bleeding. Or you may have heavy bleeding as well. Blood thinners, which we call anticoagulants, medications used to prevent clots, example, aspirin, warfarin, can cause increased menstrual flow. So the takeaway here is, if your period or your bleeding started after taking a new medication, or if you have a history of easy bruising, a doctor should assess whether an underlying medical condition or a medication can be the cause or is the cause of your irregular bleeding. So it does not necessarily always mean it is a hormonal issue or a medical issue. It could be medication, the side effects of that particular medication that is causing you to bleed heavier than usual. There are as well pregnancy-related causes to heavy bleeding. Heavy bleeding in women of reproductive age can sometimes be linked to pregnancy-related issues. So, miscarriage or ectopic pregnancy. A miscarriage can be defined, noted in early pregnancy. And if a miscarriage occurs, it can present itself with very heavy bleeding, with large clots, severe cramping, and back pain. So a miscarriage in early pregnancy can cause heavy bleeding with a lot of clots, severe cramping, and back pain. What about ectopic pregnancy? An ectopic pregnancy is when a fertilized egg implants outside the uterus. Now, this is a very serious, life-threatening condition, and it can cause severe bleeding, abdominal pain, and dizziness. And it usually occurs during or before 11 weeks pregnant. So you're having these symptoms, you're pregnant, and you're not supposed to be bleeding like that at this time. You're not supposed to be having bleeding actually at this time. So you're under 11 weeks or so, and you're having these symptoms. It can be life-threatening. So you get yourself to a healthcare facility to get an ultrasound to see what is going on. Women who can be bleeding heavy, what we call after you're having the baby, postpartum hormonal shifts. After childbirth, hormones tend to take time to stabilize, which leads to irregular, heavy bleeding for several months. But some women develop something that is called postpartum thyroiditis, which can disrupt the menstrual cycle and cause excessive bleeding. So the takeaway here is if you suspect pregnancy or have recently given birth and are experiencing unusual heavy bleeding, it is quite important that you seek immediate medical care. So of my final thoughts on causes of heavy bleeding in women 24 to 35, heavy periods can disrupt daily life and signal underlying health concerns. Identifying the cause is the first step towards effective treatment. If your heavy bleeding is irregular and comes with acne, weight gain, it may be linked to hormonal issues like PCOS, which is polycystic ovary syndrome. If you have extreme cramping or pelvic pain, conditions like fibroids, polyps, endometriosis could be the cause. If you've been experiencing dizziness, fatigue, or unusual bruising, a thyroid disorder or clotting issue may be affecting your cycle. If you recently had a pregnancy or miscarriage, bleeding may be linked to postpartum changes or complications. Now we'll discuss when heavy bleeding becomes a serious concern and you should see a doctor. When to seek medical help. Key warning signs. While some menstrual discomfort is normal, heavy bleeding that interferes with your daily life is not normal. I want to repeat that. While some menstrual discomfort is normal, heavy bleeding that interferes with your daily life is not normal. So if you experience any of the following, it's time to seek professional or medical advice. Bleeding that interferes with daily life. If you find yourself missing work or social events because of the severity of your bleeding, or if you need to plan your day around constantly changing of pads, tampons, etc., this is a clear sign that the bleeding is more than just a heavy period. Difficulty leaving the house or engaging in normal activities due to discomfort or anxiety about bleeding is a serious concern. Severe pain and dizziness or fainting. Let's look at this. Heavy bleeding can lead to severe cramps and pain, but if the pain is extreme and does not improve with over-the-counter medication, it may indicate an underlying issue such as endometriosis, fibroids, or adenomyosis. What about persistent bleeding for multiple cycles? If you are experiencing heavy bleeding for more than 2 to 3 consecutive cycles, or bleeding that lasts longer than 7 days regularly, it's quite important to seek medical help. Persistent abnormal bleeding could signal hormonal imbalances or other serious conditions that needs to be addressed. Diagnosis and tests. When you visit a healthcare provider with concerns like these about heavy bleeding, they will likely run several tests to determine the underlying cause. Here are some common diagnostic tests. Blood tests. CBC, which is known as complete blood count, to check to see if you are anemic and evaluate your overall health. Hormonal tests to check for estrogen and progesterone imbalances. Thyroid function tests, and other hormone levels. Ultrasound. A pelvic ultrasound is commonly used to check fibroids, to check for fibroids, polyps, and other structural issues in the uterus. Transvaginal ultrasound. It offers a closer look at the uterus and the ovaries to detect any abnormalities. With the uterus, ovaries, endometrial biopsy. In cases where the cause is unclear, an endometrial biopsy may be recommended to examine the lining of the uterus and to rule out more serious conditions like hyperplasia and cancer. Tracking cycles and symptoms. Keeping a detailed record of your menstrual cycle is quite important. So when you go to your healthcare provider and they are asking you questions, you need to be clear so that they would be able uh, to know how to check for the issues that you may have in according to what you are experiencing. So it is therefore important to write how heavy your pad count, which is how many pads you generally change in during when your period is heavy. That will indicate a lot of different issues. How the symptoms you're feeling, if you're passing a lot of clots, if you're having a lot of pain, can be invaluable for you and your doctor. This information can be quite helpful. It helps your provider to pinpoint certain patterns that determine the best course of action or the best course of action for your treatment. So treatment and management options. Once a diagnosis has been made, several treatment options can help manage heavy bleeding. These options range from lifestyle changes to medical treatments, and in some cases, surgical procedures. Lifestyle and natural remedies. Diet and supplements. Diet and supplements. Iron supplements can manage problems like anemia resulting from heavy bleeding. Vitamin C enhances the absorption of iron, so consider taking it alongside iron supplements. Magnesium and vitamin B6 can help reduce cramps and improve overall menstrual health. A diet rich in fruits, veggies, and lean proteins can help maintain overall health, which may help with hormone regulation. Let's look as well as stress management. Stress can contribute to hormonal imbalances that worsen heavy bleeding. Practicing mindfulness, yoga, meditation, and relaxational techniques can help reduce the effects of stress and promote hormonal balance. What about medical treatments? Hormonal therapy. Birth control in many cases are used here to help regulate hormones in younger women and to reduce the thickening or the thickness of the uterine lining, making periods lighter and shorter. Intrauterine device, which I use a lot to help women who are having heavy bleeding. It is very useful to help in reduce these heavy bleeding. It regularizes estrogen and progesterone levels. Some such IUDs that are used regularly, at least used with me, is Mirena. Mirena can reduce menstrual bleeding by releasing progestin, which thins the uterine lining and reduces blood flow. So, if you are having issues like that, I find over the years, Mirena has been used to reduce the heavy bleeding in many cases and the discomfort and the pain. And studies have shown too that Mirena is quite helpful in early stage of endometrial cancer, yes. And Mirena is effective for both contraception and heavy bleeding. For heavy people, women with heavy bleeding, it protects you, it regularizes your hormones and protects you from that heavy flow for up to 8 years. This is updated research. And in terms of contraception, it helps you to avoid pregnancy for up to 6 years. So heavy bleeding, those of you with the heavy bleeding, the Mirena helps with heavy bleeding up to 8 years and contraception up to 6 years. So progestin therapy as well can be used if estrogen levels are too high. Progestin can help balance hormones and reduce bleeding. Non-hormonal medications like NSAIDs, like ibuprofen, can help reduce pain and inflammation and also reduce bleeding by constricting blood vessels. Tranexamic acid, this medication helps to reduce excessive blood loss by slowing or the breakdown of breaking down the clots during a period. Now, there are surgical options if necessary. There are minimally invasive procedures, like what we call hysteroscopy. This is a procedure where a small camera is inserted into the uterus to look for fibroids, polyps, and other issues that may be causing your heavy bleeding. In some cases, small growths can be removed during this procedure. Yeah. There is also a procedure called endometrial ablation. Yes, endometrial ablation. This procedure removes or destroys the uterine lining to reduce bleeding. It's most often recommended, though, for women who have finished having children or don't want to undergo a hysterectomy. So the endometrial ablation is used for women who would prefer not to take out their uterus or their womb, and it is recommended for women who are past their childbearing years because it actually does reduce bleeding by removing the uterine lining. So if you're considering you're still in childbearing age, it is not the best one to use for you. But for women who are past childbearing age and are having issues with bleeding and do not want to have a hysterectomy, the endometrial ablation is another option. Hysterectomy, that is in severe cases. If all other treatments fail and bleeding persists, and it is significantly affecting a woman's health and her quality of life, a hysterectomy, which is a removal of the uterus, may be considered. This is usually reserved for women who no longer wish to have children and have not found relief through any other methods. In conclusion, so if you're experiencing heavy bleeding and you do not have to suffer in silence, seeking medical help here is quite important for both your health and for your well-being. Remember, there are multiple treatment options available, ranging from lifestyle adjustments to more advanced medical intervention. By tracking your symptoms and working with your healthcare provider, you can find a solution that works for you and improve your quality of life. Now, let's open the floor to any questions that you may have here, ladies. Any questions here? Well, then I'll go on to bleeding. Understanding
Okay.
heavy. Okay.
Night, everybody.
Hi, good night.
Nice. This is at 12.
Hi, good night. How are you?
Good. So it seems as though the thicker the walls of the uterus is the heavier the bleedings would be. So am I saying the correct thing? The wall's supposed to be of a certain integrity to enable normal bleeding. Am I saying the correct thing?
Yes, to enable normal bleeding. But if it's extremely thick, right, it can cause heavy bleeding, heavier than usual bleeding. It could be all the issues I've spoken about before, particularly in the younger women. Now, what I'm doing too now is going to women 45 years and older,
Okay. Another
right?
question. Right.
Mm-hmm.
Understood. These services that you mentioned, is
Mm-hmm.
it that they are offered with the public service or is it done privately? For
The,
instance, the one you were speaking about with the
the ablation,
um that's right. Yeah.
those I know in many cases they have them when you have been seen about privately. Most of them I know are those particular procedures are done privately.
Okay. And again, why I ask is because, many people may not be able to financially afford them, but
Yes,
it's a common, you see, those are common disorders that occur, sorry, with women. And I
yes,
know somebody might be sitting there who would really want to do that kind of invasion, but they don't have the finance to do it. So,
yes.
um, and this is just a quick thought that came here. Probably we can try to introduce. I don't know if to say this, but I'll say it anyway. We could try to introduce somebody who might be willing to, and I'm talking about a medical doctor here or a specialist in gynecological work to to address these. Dr. Khan might be able to say something on that. I'm not sure, but we could bring in somebody who can. I don't know
But
how well
Who
it
who's
will
who
sit
specialize
with the
in
public.
ablation and things like that?
Yeah, and
And
because I know, even though
mm-hmm,
it's 10 of us, nine of us, two of us, we will have some cause for wanting to find out because it's a rampant thing that goes on with women,
it
and
actually it is.
one of us may want some kind of a help for that
Yeah.
sort of that
So
sort
actually
of
that's a good idea, right?
I'm not
But
certain if I'm saying the correct thing, correct time, correct place, but I am seeing now, and this is just trying to help. This just trying to assist women because women looking for help, and they're getting real good help from um your show your sessions and so on. Very good
yeah,
advices, and because of we having these little talks and so on, it may open up. It may want us to probably open it up to a little more specialists and so on. I'm not sure.
yes, I agree. But on another note, the gynecological wards generally have a lot of procedures, right? These may not be the ones that are the ones that talked about on a regular basis, but I know that they perform a lot of the procedures I talk about here, but I know a lot of the procedures as well like the ablation, are done, I've known them to be done privately, but I'm not saying that it may not be done generally in the hospital, the general hospital setting. It is done, but I know, actually, I really know that it is really done on a private level more, right? So,
Okay, thanks.
yeah. So I want to move on to women having heavy menstrual bleed from after the age of 45. Okay. So heavy menstrual bleeding can be more common as women approach menopause, but it is not something that should be ignored. Here are the key signs. Here are the key signs. When bleeding is heavier than usual at this time. Losing more than 80 mils of blood per cycle. Typically, a woman loses about 30 to 40 mils of blood during a normal menstrual period cycle. Heavy bleeding is considered when you lose more than 80 mils. Now, this may not always be easy to measure, but it translates to soaking through a pad or a tampon every 1 to 2 hours, or having to change your pad or pads and tampon more frequently throughout the day. Periods lasting longer than 7 days, we spoke about that earlier, are considered heavy periods. So a typical cycle lasts between 3 to 7 days. If your periods are consistently lasting longer than 7 days, this is a sign that the bleeding may be excessive. Passing large clots, some of the similar symptoms that happen to younger women, passing large clots or experiencing excessive cramping is another indicator of heavy bleeding. Severe cramping may accompany this, leading to significant discomfort and interference with daily activities. So let's look at some common red flags, women in the 45 and above age group. In addition to the physical symptoms of heavy bleeding, there are other signs to watch out for, which can indicate a need for medical evaluation. Fatigue, dizziness, anemia, and shortness of breath. Heavy bleeding can lead to anemia, which is a condition where you don't have enough of the red blood cells to carry oxygen throughout your body. So symptoms of anemia, which are or included, are fatigue, dizziness, shortness of breath. If you notice that you're constantly tired, out of breath, it could be due to the blood loss from heavy periods. Unpredictable or prolonged bleeding patterns. If your cycle becomes unpredictable with periods that are either extremely heavy or come at irregular intervals, this could be a sign of underlying hormonal changes or health conditions that need attention. Now, those unpredictable, prolonged bleeding patterns can be due to you're going through menopause. So in many cases, you go get yourself checked out and they say, well, the doctor would say, all right, you are in perimenopause, so because of your the up and down, the seesaw of the estrogen and the progesterone, this is happening to you. All right, that is happening there, and so that rules out that. But what about bleeding between periods or after sex? That is one of the questions that we indicate when we are doing up the form for pap smears. Any bleeding that occurs outside your regular menstrual cycle, whether that's spotting between period or bleeding after sex. Many times we ask women, when we do up that paper for pap smear, that form, do you have irregular bleeding, that is bleeding during, or sometimes that bleeding occurs during or after sexual intercourse? That should be evaluated. These could be signs of conditions like fibroids, polyps, and even endometrial cancer, ladies. So these are things to look at. You're having bleeding during sex, you're having period bleeding after sex, any bleeding that occurs outside of your regular menstrual cycle, get that checked out. Impact on the quality of life, work, and relationships. Heavy bleeding can cause a profound impact on your daily life. It can interfere with your ability to work, engage in social activities, and maintain relationships. So what I'm saying there, it could affect your sexual life in a negative way because, I mean, you're always bleeding and you're always tired. You're going through a lot of these disruptions in your normalcy. And it can, if you're not expressive to your partner, or if you may have a partner who is not patient or understanding, it can affect your relationship, your home life, your family life, your sexual life with your husband. So if bleeding is affecting your emotional well-being, mental health, or work productivity, it is important to seek help. Get help, seek the help that you need. Understanding these signs and symptoms can help you recognize when heavy bleeding is more than just an inconvenience and when it may indicate an underlying health concern that requires attention. It is therefore important to be proactive here. Hence the reason why I'm giving out to us ladies this information, to be proactive in managing and addressing these issues, especially after the age of 45, as they can indicate changes in your reproductive health and signs of perimenopause. So causes of heavy bleeding after 45. As women approach perimenopause, which is the transitional period before menopause and beyond, several factors can contribute to heavy bleeding. Understanding these causes can help in identifying the source of the issue and guide the appropriate treatment. So let me break it down for you all quickly as I deal with the women, the older women who are having bleed. Let's break down some of the most common causes. Perimenopause related changes, fluctuating hormonal levels, estrogen and progesterone imbalances. As women approach perimenopause, usually starting in their mid to late 40s, the levels of estrogen and progesterone begin to fluctuate, it causes a disruption in the hormonal balance and can lead to irregular periods and changes in your menstrual flow. Estrogen levels can become much lighter, estrogen levels can become much higher than the progesterone, causing the uterine lining to grow thicker. Hence the reason why it gets thicker than usual. Now, when it sheds, it results in a heavy bleeding. Now, these fluctuations can cause periods to become more frequent, and it can cause your periods to come unpredictable or longer. So usually, at a certain age, up to a certain age group, or up to the perimenopausal age group, or before perimenopause, let's say before the perimenopause, you have a 28-day cycle. And later on, even before perimenopause starts, as you get older, you drop to a 32-day cycle. Now you reach this 32-day cycle and perimenopause steps in and you realize that you are having more frequent, unpredictable, and longer periods. That could be menopausal in many cases because it is fluctuating hormonal levels. So go get it checked out. It may not be that you have anything adverse, but it could mean the beginning of the transition from perimenopause into menopause into postmenopause. Another factor that could cause bleeding is irregular ovulation leading to unpredictable bleeding. Now, during perimenopause, women may experience irregular ovulation, meaning the ovaries do not release an egg every month. Without regular ovulation, the balance of estrogen and progesterone is disrupted, leading to heavier and or longer periods and sometimes spotting in between periods. So it is important, ladies, that we really go by a gynae, get these things checked out. What about uterine and gynecological conditions? Fibroids and polyps, common and can cause heavy excessive bleedings. We know fibroids are non-cancerous and can cause excessive or heavy bleeding, especially in perimenopausal women. They are often asymptomatic, generally, right? So sometimes they have fibroids and they cause no symptoms, hence the reason why we say is asymptomatic. But large fibroids can lead to increased blood loss during menstruation. However, I want to interject here as well that sometimes we have smaller fibroids, and because of their location, they might be in the uterine form, in the uterine lining, where there is heavy that is an area where it is a vascular area, so it's getting a good blood flow. Hence, it causes you, even though they are small, but because of where they are located, it causes heavy bleeding. So not all large fibroids cause heavy bleeding. Sometimes smaller ones, due to where they are located, cause heavy bleeding. So that can be common causes during perimenopause. Polyps are also what we call benign or non-cancerous growth in the uterine lining that can result as well in heavy bleeding or spotting between periods. Women with fibroids or polyps may experience painful cramping or pressure in the pelvic area. Now let's look at what we call endometrial hyperplasia. I spoke about that a few times earlier on. Endometrial hyperplasia, which is a thickening of the uterine lining. Endometrial hyperplasia occurs when the uterine lining or the endometrium becomes too thick. This condition is often caused by an excess in estrogen without enough progesterone. Remember, we are going through what we call a seesaw at this time. So your estrogen levels without it is increasing, but the progesterone levels is not enough to balance it off. Hence the reason this is common during the perimenopausal phase. So a thickened uterine lining can result in heavy menstrual bleeding and spotting between periods. Now, if untreated, it can increase the risk of developing endometrial cancer. Endometriosis and adenomyosis, which are conditions where uterine tissue grows outside or in the muscle of the uterus. We spoke about that earlier. So the endometriosis is a condition where the uterine tissue grows outside the uterus, causing heavy bleeding, and the adenomyosis occurs when the endometrial tissue grows into the muscle of the uterus, leading to heavy bleeding, painful periods, bloating, and pelvic pain. So more serious medical conditions to look at: uterine or cervical cancer, post-menopausal or bleeding should be evaluated. Now, although less common, uterine cancer or what we call endometrial cancer or cervical cancer can cause abnormal bleeding. Women in their 50s or older who experience bleeding after they have passed menopause or irregular bleeding should have this evaluated by a healthcare provider. Postmenopausal bleeding is considered a red flag. I've had patients who've been past their menopausal age a number of years, in their 70s and their 80s, and bleeding has occurred. And it is a red flag. And it is always to be checked and investigated to rule out cancer or other serious conditions. So ladies, you're past menopause, you're in the postmenopausal phase, and bleeding starts back, it is a red flag. It is something not to brush aside because you are not in your childbearing stage at this time, and estrogen levels are decreased to that point where you're not ovulating, and all of those issues, that transition has passed, and one day you get up and you start bleeding. That is a red flag. Get it checked out. Thyroid disorders, which affects hormonal regulation. That's another area we want to look at now. Hypothyroidism, which is an underactive thyroid, or hyperthyroidism, which is an overactive thyroid, can both affect menstrual cycle. When the thyroid hormone levels are imbalanced, they can also impact the regulation of estrogen and the progesterone, leading to heavy or irregular cycles. Women with thyroid disorders may also experience other symptoms like fatigue, weight gain, and loss and mood changes. So hence the reason why when women are going through particularly hypothyroidism, you know, the thyroid, one of the things it regulates is your metabolism. So many women gain weight when they're having thyroid issues. So ladies, these are some red flags you should get checked out as well. Let's look at blood clotting and blood and disorders making bleeding heavier or prolonged. Conditions that affect the blood's ability to clot, such as von Willebrand disease or hemophilia, can lead to heavier bleeding during menstruation. Women with clotting disorders may experience prolonged periods, easy bruising, and excessive bleeding after an injury or surgery. Now, if you have a family history of clotting disorders or experience heavier than usual periods, it's important to discuss this with your healthcare provider. What about medications, blood thinners, medications like aspirin, anticoagulants can increase bleeding. We spoke about that earlier. Hormone therapy or birth control can influence bleeding patterns. Women on hormonal replacement therapy during perimenopause or postmenopause can experience changes in their cycle, including heavier periods. Some forms of birth control, especially IUDs or hormonal pills, can also cause changes in your bleeding pattern. It is therefore important to report any abnormal changes in bleeding to your healthcare provider if you are using hormonal treatments or adjustments. Because sometimes you might try something and it may not be agreeing with you and causing you excessive bleeding. Go get that checked out. It may be that it may not be compatible to you and it is making or exacerbating the problem. Understanding the causes of heavy bleeding after 45 is therefore crucial in determining your right course of treatment, whether it's related to hormonal changes from perimenopause or an underlying medical condition. Identifying the root cause can lead to more effective management and an improved quality of life. So if you notice unusual bleeding patterns or experience any of the symptoms we just discussed, do not hesitate to seek medical help. Deal with the problem head on because it can, as we were discussing earlier, it can cause you to have a number of other issues. So the heavy bleeding can cause you to have weakness, anemia, you're disrupting your work schedule. It affects you in a number of ways that are not positive. When should you seek medical help? It is important to recognize when heavy bleeding is more than just an inconvenience and requires medical attention. While perimenopause or menopause can cause some changes in your menstrual cycle, certain warning signs should never be ignored. Understanding these can help you take action before more serious conditions develop. So, as we spoke about earlier, do not ignore what your body is telling you. These symptoms are serious. So bleeding that lasts for more than 10 days. This is abnormal. Heavy flow that causes anemia, symptoms, extreme fainting, dizziness, pale skin, abnormal. Get it checked out. Bleeding between periods, after menopause and after intercourse, serious. These are serious issues that need immediate medical intervention. Sudden changes in your period patterns, if your period suddenly becomes much heavier, lasts longer, or you experience significant changes in your cycle length, these changes should be taken seriously. Unpredictable or irregular bleeding can be a symptom of hormone fluctuation due to perimenopause, or it can indicate a gynecological condition such as endometriosis, fibroids, or endometrial cancer. So therefore, there are diagnostic tests you should take. If you have these warning signs, your doctor may recommend several tests to help identify and the causes of your heavy bleeding. Blood tests are commonly used to check hormone levels, your estrogen and progesterone, and to assess your iron levels, which can reveal if you have anemia caused by the heavy bleeding and the blood loss. Low iron levels may indicate heavy or prolonged bleeding. Ultrasound, MRI, or hysteroscopy to examine the uterus. The ultrasound is often the first imaging test that is used to look for fibroids or polyps. MRI may be used in a more complex case, providing a clearer image of the uterus and the tissues and the structures. And the hysteroscopy involves inserting a camera into the uterus to directly observe the lining of the uterus and to identify abnormalities there that may be contributing to the heavy bleeding. What about an endometrial biopsy to check abnormal precancerous cells? Now, if there's a concern here about endometrial cancer or other serious condition, an endometrial biopsy can be performed. During this procedure, a small sample of tissue is taken from the uterus with the use of a tube. This helps the doctor determine whether there are precancerous cells. These cells are then taken out and put in a solution and sent to the lab to check the lining of the uterus, to check for anything that may be abnormal. So if you experience any of the warning signs, ladies, such as prolonged bleeding, symptoms of anemia, bleeding after menopause, or drastic changes in your cycle, don't hesitate to call your provider. Early diagnosis is the key to managing heavy bleeding effectively and ensuring your long-term health. So by undergoing these diagnostic tests like blood work, ultrasound, endometrial biopsy, you and your doctor can identify the root cause and explore best treatment options. So lifestyle and natural approaches, we have iron-rich diet to prevent anemia, foods high in iron, dark green leafy vegetables, which in turn can help with the anemia. So focusing on iron-rich foods, spinach, callaloo bush that we have in the West Indies and a lot of other places, spinach, callaloo bush. We have also people who use lean meats, lentils, fortified cereals, as well as iron supplements may all be used as to use to help with the symptoms at this time and recommended by your doctor. Blood tests that show with women with blood tests that shows low levels, pairing iron-rich foods with vitamin C found in citrus fruits, tomatoes, peppers can help you to improve the absorption of the vitamin C. Anti-inflammatory foods and supplements like vitamin C and magnesium. The magnesium, inflammation is often a factor in conditions of endometriosis and fibroids, which can contribute to heavy bleeding. So the vitamin C and magnesium is important here, as well as the foods, which helps reduce inflammation. And supplements many times supplements like magnesium and vitamin C can aid in reducing menstrual pain and supporting overall health. And we cannot underestimate the importance of stress management techniques like yoga, meditation, deep breathing exercises to reduce stress. Try and reduce what I do, stressful people and stressful situations on a general basis, and take some breathing exercises, a few minutes and work every day. You take a little 2 minutes a few times and get in a quiet area and take some deep breaths. It helps with the stress. So there are hormonal treatments, low dose birth control, progesterone treatments, IUCD, which is intrauterine devices. There are surgical options that we spoke about earlier, like the endometrial ablation, hysteroscopy, hysterectomy. So as we conclude today's presentation, I want to leave you all with some key takeaways to help you to better understand heavy bleeding after 45, the importance of taking action if you experience any concerning symptoms. Heavy bleeding after 45 is not normal. Pay attention to changes. Many causes are treatable from perimenopause before they turn into very serious conditions. Seeking timely medical care can prevent complication and improve your quality of life. Treatment can significantly improve your quality of life and prevent further complications, ladies. So this was a very wide and long topic, and the reason why I did this topic is because I myself has some experience with heavy bleeding and took certain steps to get it under control. Mine was using changing my diet, using a lot of supplements, because I was not one of the best candidates for surgery. And so I had to reduce my bleeding, and I had to get my symptoms under control. I did stress management, which helped a lot with my bleeding. When I'm stressed, I bleed more. I realized that was my issue. When I'm in a stressful situation, I bleed more, right? I also decreased a number of processed foods. So I decreased processed sugar immensely. I get my sugar more or less from fruits now. I cut down processed food. I eat my foods as natural as possible. I increased my iron intake. I use vitamin C. All of these have, in the long term, caused my bleeding symptoms to decrease a lot. Now, what works for me may not work for you, because we all have different issues hormonally if we are experiencing bleeding. So get yourself checked out to see what are the best options for you at this time, ladies. So at this point, if we have any questions, we can go ahead and ask, because in the area I work, I deal with a lot of ladies who have bleeding during the postmenopausal, perimenopausal phase. And there are options, there are a lot of referrals that take place as well. So if you are having these issues, do not say it is normal to bleed heavy at this time. It can lead to further complications, and that those complications can be life-threatening. So deal with the issues of these heavy bleeding When they arise, as soon as you could, go and check out your healthcare provider, get the necessary tests done to prevent further complications. So at this time, anybody wants to ask a question here?
I know it's some minutes after 8,
Yes, we
so
went extremely
probably
long tonight.
long tonight, yeah.
Mm.
So, and polyps, um, as opposed to, um, there's another, besides the fibroids, we have
Mm-hmm.
something else. We have something else besides the fibroids and
Polyps.
the polyps. We have something else that area grows sometimes. The name can't come to mind now. The name was just there, but because of sometimes I just forget what I have to say, but
Okay,
I
to
just know what I
present.
have to say.
Okay.
Yeah. So if it should come back before we close up tonight, I'll just quickly say it. So you'll ask me if you'll answer me if it's the same thing or if it's something different. All right.
So what's the question? Or
Can't
is it a
remember the name
comment?
of the. No, it's
Okay.
something I wanted to ask you
Okay.
that the uterine system also area grows at some point in time.
Yeah, we
And
spoke about endometriosis, adenomyosis. We
yeah, we
spoke
spoke
about
about the polyps and the
polyps,
thickening of
fibroids,
right
the thickening of
fibroids.
the
And there's
endometrial tissue,
Mhm.
right? Due to the extra estrogen and the decreased progesterone, and it causes that heavy bleeding. And what with the options that we have at this time that is available for a lot of women, you know. So those are the topics.
I just
Those
I
the
just
main.
also wanted sorry,
Mm-hmm.
I'm sorry.
Go ahead.
I just wanted to ask or probably say
Mm-hmm.
or ask, it's more song like ask than say about your personal clinic because I am saying this because some women will prefer to come to the, private clinic rather than the public clinic. I know this will go public, but I'm still saying some people will prefer to, go privately and have it done, and nothing is wrong with it, with doing such because it's to the comfort of how the person feels. I know publicly we offer some really, really good service too. Yeah.
Yes, yes,
And
we do.
I am a product of working in the medical field, so I'll be able to say that. But I also want to say if people wants to go a little more, secretive, private, um, now this is the time people can ask you about your services, your private services, as the case may be. You are very registered, you are eligible to do it, and then they will get just due for what they're really looking for. I,
Yeah. In the clinic that we are still we are basically open, but what we have, what we basically do at this time, we give a lot of counseling, we do a lot of referrals, we do pap smears, breast exams, we do we offering family planning, advice, um, we are doing a lot of things that are woman related. We have natural products as well online, which we'll get into to because we all my emphasis is on natural, on dealing with products as chemical free as possible to help us at this time, because we know at this time we are so sensitive to a lot of things and it can contribute to the issues that we are having during this menopause transition. So a lot of the products I'm aiming for is products that help with hair, particularly skin, natural products. So those will be coming online very soon as well in the clinic. So these are what we have available for now, and as we grow, there will be more services offered to patients. So it is important that you can contact us and we would do the needful. Pap smears are very available. I have a very comfortable, because many times women going to do pap smears, they are uncomfortable. I have a very um comfortable bunk, and I have the nice and peaceful environment, very private. Some of you who cannot do it in the week can do it on the weekend by appointment. So all of these things, they are available by appointment, and we will do the needful for our patients. So ladies, tonight, I know that we went a little over because this is such a timely topic. I had to just go into depth because a lot of us are suffering in silence. So you need to know that there are options out here to deal with these issues. If you are having these problems, do not take it lightly, because they can just exacerbate and become worse. So deal with heavy bleeding, deal with all these issues, fibroid problems, polyps. You may be having bleeding, you don't know the cause, go get it checked out. It will not just vanish like magic. Okay? So I want to say a
Um,
pleasant good night to everyone. Somebody was saying something?
no, yes, it's me. I just remember the name, Cis. I wanted to know if cis and polyps is the same. Sorry about that, ladies.
A cyst is more of a fluid-filled growth, right?
Okay.
And it is not a polyp. It's a is the then the cyst could happen in different various parts, right? But the polyp is the growth that take place in that particular area. It could happen outside the uterus by the os area, where I see sometimes when we do pap smears, or it can be in the inner part, right? It is non-cancerous, but it can cause bleeding, heavy bleeding, discomfort, pain, and a lot of other symptoms, right? So yeah, it's two
Thank you.
different things, right?
Yes, thank you.
So
Thank you.
you're welcome. So ladies, I'm saying good night. I don't want to overstretch our welcome. We really did a lot of talking tonight because it's a very serious and important topic. So I want to thank you all again for coming and for giving of your time. And I want to say that next week, because of the holiday, we will not be online next week, Tuesday, but we will be back online from the following Tuesday. So I would like to say extend a pleasant, you have two holidays clashing, which would be Eid and the Baptist Shouter holidays. So I wish you all enjoyable holiday coming. This be a long weekend. Enjoy, be safe until we all meet again to discuss some more pertinent issues. And ladies, if you have questions for the next session, please ask. Even if it's a question from this week, I'll do my best to answer your questions. So thank you for coming. And I look forward to seeing you all in my next session, which will not be next week, the week after.
Thank you so much.
Thank you, ladies.